Hello, everyone, and thank you for joining us to this Benefits Integrated presentation. I'm Becky McGregor, your APS Employee Wellness Coordinator, and with us today is Amanda Romero from Blue Cross Blue Shield of New Mexico. Your benefits are integrated, and one of the things that we work together with Blue Cross is coordinating care solutions for your holistic health and well-being. And this presentation from Amanda is going to show you all of those resources that you have available to you with Blue Cross Blue Shield. And with that, I'm just going to kick it over to Amanda.
Awesome. Thank you, Becky. Hello, everyone. As Becky mentioned, my name is Amanda Romero. I'm an account executive here at Blue Cross Blue Shield. I am assigned to APS, so I get to work with your wonderful APS HR and benefits team all year round. Today, we are going to be talking about your Blue Cross Blue Shield benefits. We'll talk about all of your plan features, customer service, and all of the resources that are available to you, online tools and resources, as well as health and wellness programs that are all included in your Blue Cross Blue Shield plan. Blue Cross Blue Shield has a nationwide network with over 1.5 million providers. We have more than 9,000 hospitals. Within your Blue Cross Blue Shield plan, you have nationwide coverage throughout the whole United States, and you also have coverage when traveling with over 190 plus countries and territories. APS offers a PPO plan. So what that means is you have access to that nationwide network. You can find in-network providers, whether you're in California, New York, Texas, anywhere that you are, as well as out of the country, as I mentioned on the previous slide. We really encourage you to utilize your in-network providers, because when you utilize in-network contracted providers with Blue Cross Blue Shield, you receive the highest level of benefits, and you're also receiving those in-network benefit payouts, which we'll go over on the next slide. You're also protected from balance billing because we do have contracts with those in-network providers. You do not need to fill out any claim forms, you don't need a referral, and you do not need to select a PCP when you see an in-network contracted PPO provider with Blue Cross Blue Shield. On the APS plan, you do have access to out-of-network providers. However, we encourage you, as I mentioned, to see in-network providers when necessary. However, in the event that you do need to see an out-of-network provider, keep in mind that you may have greater out-of-cost share. You will receive lower benefit or fewer benefits out-of-network, which we'll review on the next slide. You will need to file your own claim, and because we do not have a contract with those out-of-network providers, you may be balance billed from those providers. Here, if you ever need help finding a new provider, you can find a new provider on the Blue Cross Blue Shield nm.com APS website, and you'll just click on doctors and hospitals. Or you can call the concierge team. We have teams with Optum and Loveless. They know your APS plan. So all you would need to let them know is that you are an employee or member of the APS benefit plan. And you can call either of these numbers and they can assist you with finding a provider, finding a primary care physician, or a specialist that is in network. Here we will go over your benefits. These will be your benefits for plan year 2024. There will be no changes other than the COVID coverage, which I will go over here shortly. You will see there on the first column where it says nationwide PPO, those are going to be your benefits that are in network. So anytime you see an in-network contracted provider, those will be your benefits. Then you'll see on the very far right the out-of-network column. These will be your benefits if you end up seeing an out-of-network provider. If you are enrolled employee only, your deductible will be $1,000. If you're enrolled employee plus one, it's $2,000. And if you're enrolled employee plus two or more, it's $2,500. You only need to satisfy that deductible for certain benefits. And on this screen, you will see anywhere there's an asterisk, that is where you will need to satisfy that deductible first. Then your out-of-pocket maximum. I like to think of my out-of-pocket maximum as my safety bucket. So this will be the most that I will pay per calendar year for covered medical benefits. So if you're enrolled employee only, it'll be $5,000, employee plus one, $10,000, or employee plus two or more, or employee plus one or more, it'll be $12,500. Everything applies towards that out-of-pocket maximum of covered benefits. So if you had to pay your deductible, that falls into your out-of-pocket maximum. If you have to pay a copay for seeing a primary care physician, that goes towards your out-of-pocket maximum. And all of those start to trickle up. And as soon as you hit that out-of-pocket maximum, APS pays the remainder of the benefits for the remainder of the year if you hit that out-of-pocket maximum. Your preventative services are covered at no charge as long as you see an in-network provider. Some of those preventative services are your routine physical, gynecologic exams, well child's care, colonoscopies, immunizations, etc. As I mentioned, the COVID coverage has changed. So this is going to be based on place of treatment and type of service. So what that means, if you go into your primary care provider and you get a COVID test, you're going to be charged your copay based off of that. If you end up in the hospital due to COVID, you are going to pay based on your inpatient or outpatient, depending on your treatment. You will be charged based on that. Your MD Live visits, no change there. Those will be no charge. That also includes your behavioral health virtual visits. Behavioral health appointments such as office visits, outpatient and inpatient, those are all no charge to you. Primary care visits will remain the same at a $30 copay. Specialist $60 copay. Your allergy office visits, which includes testing and treatment, will remain the same at $60. And then allergy extract prep, serum, and injections, those are $10. That's a $10 copay per visit. Your lab x-rays and EKGs are covered after a $30 copay. All of your advanced imaging, if it's at a freestanding imaging center, it's $120 copay per day. If you get these advanced imagings in a hospital, it will be 20% after that deductible. Urgent care will be covered at 100% after a $75 copay, emergency room $450 copay, and then your outpatient visits and your inpatient visits are going to be covered at 20% after deductible. And again, as you make those payments, those all start trickling up and adding towards your out-of-pocket maximum. As I mentioned, you still have access to your virtual visits. Virtual visits are access to medical providers 24/7, 365 days a year. You and all of your members that are covered under your APS benefit are able to utilize this benefit. You can access a provider via phone, online video, or through your mobile app. You can call and get seen within an average wait time of less than 20 minutes, or you can also schedule an appointment whenever it's best time for you. These MD Live doctors can treat a variety of non-emergency conditions, including the below, such as allergies, asthma, cold and flu, depression, nausea, pink eye, sinus infections, and so much more. To get access to your MD Live benefit, there are 4 different ways you can access your MD Live benefit and your account. You can call MD Live at the number listed on the screen. You can go to mdlive.com/bcbsnm. You can text BCBSNM to 635-483, or you can download the MD Live app. I have MD Live on my phone. The number saved because you never know when you're going to need it. So it's good to have that number handy for you. You also have access to 24/7 nurse line. So this gives you round-the-clock health and wellness advice from our licensed nurses. Again, it's available 24/7, 365. The number is listed here on the screen. This is another number that I have in my phone because, again, you're never going to know when you're going to need it. Next, we're going to go over all of the online tools and resources that are available to you as a Blue Cross Blue Shield member. First, we'll go over Blue Access for Members, also known as BAM. This is going to be your online personal portal. So on Blue Access for members, you can check claims and history, you can view your explanation of benefits, you can sign up for electronic explanation of benefits, you can check the coverage of your of any service that that you may be needing to get. You can request new ID cards, you can get access to your health and wellness resources that are available, and you can also utilize this portal to find a provider. This portal is available to you 24/7, 365. Those of you that are not Blue Cross Blue Shield members, I encourage you to sign up whenever you do register for Blue Cross Blue Shields, or those of you that are currently Blue Cross Blue Shield members. I hope that you have this portal already. If not, this is the way that you will sign up. You'll go to bcbsnm.com and log into Blue Access for members. You're going to click on register now. All you're going to need is your identification number that is listed on your ID card. And then from there, you're able to create a username and password. On Blue Access for members, there's so many different resources that are available to you, as I had mentioned on a couple of slides prior. You will see here just navigating the system. So you'll see there you can view your coverage where it's listed number 1, the claims center, your health and wellness. You can find doctors and hospitals. You can download forms and documents. And then on number 6, you can see there, those are just quick links where we get the most clicks. So we want to make it easy and accessible to you to find. You can find your member discounts. You can request a new ID card. And then you can also access your Well on Target wellness portal. When you are looking for a provider under Blue Access for members, you can do that under doctors and hospitals under the tab, or you can utilize Find a Doctor under your Blue Cross Blue Shield mobile app. Inside your provider finder, you can look up out-of-pocket costs for over 1,600 specific procedures. This tool is really neat to utilize so that you can understand what the expected out-of-pocket costs are for any planned services that you have coming up. You could also look at the quality designations for facilities and physicians, and then also customize your search based on where you are or where you need to find a provider. You can also get cost estimates. So this is how you can find the out-of-pocket costs depending on the provider that you choose. Every provider has a different contract with us, so it's really good for you to look on this resource that is available to you to see who has the lowest cost and also has the best ratings possible. And then you also have access to Blue Access for members through your mobile app. You can do the majority of the same things that you can do on the computer on your mobile app. To download this app, you'll just go to Google Play or the App Store, or you can text BCBS NM app to 33633. On here, you can find your claims, coverage, deductible information, access a digital ID card, and just look at your communication preferences as well. Next, we're going to go over your health and wellness resources that are available to you. The first one is the health advisor. We also refer to this as a case manager. They can help you coordinate your health, your family's health concerns. They can answer any questions that you may have. They can give you, referrals to any specialists or refer you to anybody that is in network, help you find a provider, and also help you with those cost estimated tools that are available to you on the Blue Access for Members website. You also have access to our behavioral health Learn to Live program. This gives you a variety of, well, not a variety, but access to a personal coach or a consultant that is able to assist you and your family members with stress, anxiety, worry, depression, social anxiety, any of your behavior health concerns. This is available to you and your members that are covered under your APS plan for members 13 years and older. There are English and Spanish providers that are available to you, and you're able to talk to them on the phone, you can text, or you can email. In order to get started with this, you can log on to your Blue Access for members, and then you'll choose the Wellness tab to find the digital mental health program known as Learn to Live. Now we'll go over your wellness portal. So within your Blue Access for members, you're going to have access to a wellness portal, which is called Well on Target. On your Well on Target wellness portal, you're able to take a health assessment, utilize your member dashboard, which is personalized to you. You can participate in self-management programs. You can utilize the trackers and tools where you're able to sync your Fitbit or your Apple Watch. There's also interactive symptom checkers. There's health and wellness content. There's secured messaging if you needed to reach out to a coach. There's also tracking for fitness and nutrition, as well as personal wellness challenges that are available on there. So you're going to have wellness available to you within your Blue Access for members. There's so many self-management programs that I had mentioned that's part of your wellness program. So there's interactive and there's educational topics that are available to you. So some of the interactive ones are managing your stress, improving your sleep, nutrition for better health, improving your oral health. And then the educational well-being topics include healthy bones and joints, living with asthma, improving your cholesterol, healthy pregnancy, and then preventive health, so reducing your risks. All of these are available to you on the Blue Access for members Well on Target portal. As a Blue Cross Blue Shield member, you do have access to our gym network. So what this is we have a tiered program. So you have a choice of gym networks that fit your budget and your preferences. So on here in the table that you see on the slide, you're going to see the different plan options. There's a digital only, there's a base, there's a core, a power, and an elite. Those are all different options that you have available. You will see the fee that is available, or the fee that references to each tier, and then you're going to see the gym network or facility size. So you can see it goes from digital access only all the way to elite, where that's going to have the most gyms that are in that network. On the bottom there, you'll see I listed a few of the gyms that are available in each tier. Under the base tier here in the Albuquerque area, the base tier includes your Planet Fitness and Choose Fitness locations. The core gives you access to everything that is in the base, so the Planet Fitness and Choose Fitness, plus you're going to have access to Stretch, Strength, and Fitness, Power Flex Gym, Go Time Fitness, Body Mass Foundation, and Frontline Coalition. And then the power tier, you're going to get everything that's included in the core and base tiers, but you're also going to have access to the Anytime Fitness locations, Rio Rancho Aquatic Center, the YMC Horn location, Moe's Gym, Crunch Fitness, and Soul Fitness Club. And then the elite, which has the most gyms, is going to include base, core, and power tiers, plus Amplify Strength and Conditioning, Elite Physique gyms, CrossFit, Thunderhawks, and so much more. Keep in mind these examples that are listed here are just in the Albuquerque area. Within those tiers, you have access to gyms nationwide. So if you were traveling and you wanted to see, visit a gym, you can certainly do that with your Blue Cross Blue Shield card if you're enrolled in any of these tiers. You can go on to your Blue Access for members and locate gyms once you are a part of the gym program, and you can locate gyms that are closest to you. Within this gym network, you're able to go to a variety of different gyms. You can go to 2 different gyms in one day. So if you wanted to go to Planet Fitness in the morning and then YMCA after work, you're more than welcome to do that. So this is our discounted gym program that is available to you at a low cost. Then, just for being a Blue Cross Blue Shield member, you are eligible for the Blue 365 member discount program. So what this is again, just for being a Blue Cross Blue Shield member, you are eligible for a variety of different discounts. So there's so many discounts that are available to you. Again, you'll have access through this on your Blue Access for Members portal. You can get 20% off Fitbit devices. You can get discounts on TVs, hearing aids, vision exams, gym memberships. So this is a little bit different than the fitness program. So let's say that you wanted to have one sole gym membership at a certain gym. You can look at discounts on that through the Blue 365 gym membership discount program. And then you can also get discounts on nutrition-related services. There's a variety of different things. There's so many things that are popping up every day. So I encourage you to go in there and look at it before you purchase anything, because you never know what discounts you are going to be able to find in there. And then women's and family health. So as a Blue Cross Blue Shield member, you have access to our women's and family health program, which is called OVIA. So OVIA helps with prenatal while you're pregnant, postnatal, as well as menopause. So it helps members with any that fall in any of those categories. You will just download the Ovia Health app. You can track your cycle, your pregnancy, your baby's growth, and then you can also get self-guided courses that help you with your healthy pregnancy, baby, your menopause, postnatal, all of that good stuff. So again, that is available to you on the Well on Target Blue Access for Members portal. And then as a Blue Cross Blue Shield member, you can download the Ovia Health app and just select what program that most fits your needs. And then Wonder, you still have access to Wonder. So Wonder is going to be a weight management and diabetes prevention program. It's also known as a metabolic syndrome reversal. So metabolic syndrome is a cluster of conditions that can increase the risk of heart disease, stroke, and diabetes. So what this program is you have access to an online personal coach where you're able to email or chat with them on a phone or via text or through the portal. They assist you with with the program that best fits your needs based on what you're needing assistance with. So is it diabetes prevention? Is it weight management? Whatever it may be. And they're able to help you with behavioral health skills. So there's no dieting that's included in this. They truly help you just make a long-term weight management and diabetes prevention skills that are going to assist you and help you live a healthy, happy life. In order to enroll in this, you can just visit wonderhealth.com/APS to get started. This is no out-of-pocket cost to you. This is a free program, so we encourage you all, if you have any interest in this program, to get started. And with that, that is all that I had for you. I will go ahead and pass it over to Becky.
Thank you so much, Amanda, and I really appreciate that presentation. And I just want to encourage everyone, a couple of things that Amanda mentioned, the Blue Cross Blue Shield app and your Blue Access for members. It is really a good idea to connect and to make sure when you hit the communication preferences that you are connecting and receiving and opt in for the things that they're offering, because they are very good about continually connecting with the members and outreaching. And so we want you to know your resources, but we also want you to know that it is integrated for a reason. So when those health advisors call you, or an outreach person, take the call and connect with your Blue Access so that you can receive on a regular basis all the reminders and information that they have available to you. That is your benefits integrated, and we want it for you. So again, on the Well on Target, I want to just mention, this is in addition to the APS program. So I just love the fact that Blue Cross offers the Well on Target. It's something you can access. We also have the overall APS wellness program. So just know that this embeds underneath that. So you have a lot of resources to help yourself get healthy and well. And we want you to utilize it and know about it. So thank you so much, Amanda. And we have a couple of reminders here about Open Switch enrollment. So Open Switch enrollment is October 2nd through the 17th. and that is for your benefits that start January 1st, 2024. You will receive emails. Open enrollment is completely online. So starting October 2nd, Monday, you will receive emails inviting you through the process. You'll have links to join through Winocular Workspace. That is the same platform that you use to sign your contracts and for job openings. So you're familiar with that platform. You're going to get those emails. It's going to walk you through the process. All benefit eligible employees receive those emails from hr@aps.edu. And again, just a real quick reminder on our ASI Flex Healthcare and Dependent Care Flexible Spending Accounts. Those are benefits you have to re-enroll in every year. So if you have Blue Cross Blue Shield now and you just want to keep it, that's fine. But you do still need to engage in your benefit enrollment form to re-enroll in your health care spending account. Okay. Attend the APS Employee Wellness Fair because that's going on October 3rd and 4th. That's Tuesday and Wednesday. And we have just a lot of things going on. We're going to have benefits information sessions. Amanda will be there again presenting this, but she'll also be on hand to answer questions. And we have assistance with enrollment. We have wellness screens. The Blue Cross Blue Shield Caravan will be there on Tuesday. And so we have a lot of great resources there for you. Vaccinations, mammograms, and a blood donor drive. We want you to schedule ahead. Vaccinations are scheduling ahead right now. So you can go on your open enrollment site. That URL is right there, and you can schedule ahead for your vaccines and your mammograms. So we thank you so much for this presentation, for joining Amanda and I for this benefits integrated presentation. And if you have any questions, Amanda, can you forward the slide real quick? If you have any questions, we have two emails for you: employee.benefits@aps.edu and employee.wellness@aps.edu. Two places you can go to ask questions, and we encourage you to reach out if you have any questions at all. We really do encourage you. And we want to thank Amanda, and we want to thank Blue Cross Blue Shield for this presentation today.